Hey guys, what's going on? As you can see, I'm in a hotel room on the road this week at bodybuilding.com, filming some content for some different things. So pretty exciting. I'll keep you guys updated on that. And then I head to Louisiana, meeting with the Avatar Nutrition crew about all the stuff we got going on. So pretty exciting week for me, but I've really dedicated myself to putting more content out there. Obviously, there's been a lot of stuff that's went down this week that caused me to have some non-informational content, and I apologize for that. But I'm still going to keep this stuff coming, and I realize some of you may disagree with how I handled that situation, and you're entitled to your opinion, but I felt like that needed to happen. So it doesn't look like anything's going to come from it, which is what I expected. But hey, like I said, it's what I expected. I just wanted to prove a point. So anyway, today I wanted to talk about blood flow restriction training. And I've seen some criticisms of it out there. And this is a larger symptomatic problem of things that really, really bother me. And one of those is that we have so many people out there who say they do research, or that say they're evidence-based or science-based. And when I watch the stuff, it's just, it's cringeworthy. It really is. And I've seen some different people talking about blood flow restriction that just absolutely, it makes me want to get sick. Like, it makes me want to vomit. Like, with how badly they get it wrong. And they get it wrong every time they talk about it. And this is the difference between people who just read Google, who believe that going on Google and reading the opinions of other people and then regurgitating those opinions as their own is research, versus actually doing research. And not just reading papers, being in the lab, dealing with subjects. So, let's talk about it. Let's talk about some of these criticisms. Well, first off, some of you guys may be wondering what exactly is blood flow restriction training. Blood flow restriction training is a form of training where you're using a very light load and you're applying some kind of cuff to the limb. So at the top of the thigh or the top of the arm, you're applying some kind of cuff. The purpose of which is to restrict blood flow, specifically the venous return of blood flow. I want to be very specific about this. You are not restricting the arterial, you're not supposed to restrict the arterial delivery of blood to the muscle. What you are restricting is the venous return. The idea is that you are causing a fluid shift and causing blood to accumulate, fluid to accumulate, metabolic byproducts to accumulate in the muscles that you're targeting. Now, why is that good? Well, if you look at some of the research, what you're basically able to do is replicate the hypertrophy benefits of lifting heavy weights to failure with lifting very, very light weights. Okay? We're talking about as light as 20% of a 1 rep maximum. Further, there's evidence that one of the first studies on BFR showed that simply applying tourniquets to the top of thighs and having people walk, now these were untrained people, but having them walk, caused significant hypertrophy to their leg muscles. Further, people who were bedridden when blood flow restriction was intermittently applied during bed rest, which is a situation where people lose massive amounts of muscle, these people actually maintained more muscle than those who did not. Again, you lift weights, you get more muscle. You walk, you get a little bit more muscle, as long as you're untrained. Now, trained people aren't going to have hypertrophy from just walking with BFR, but maybe it'll be, if they're injured and can't lift, maybe walking with BFR would help maintain muscle. And then, of course, bedridden, using BFR, maintain muscle. Well, how? Well, it looks like there might be a few different mechanisms. By restricting venous return of blood, you cause a significant fluid shift. And anybody who's ever done blood flow restriction training has noted that you get the craziest pump you've ever had in your entire life. Okay? You're getting a lot of fluid accumulating in that area. You're getting a lot of blood accumulating in that area. And furthermore, that fluid shift may in and of itself be anabolic. There's evidence that cellular swelling is anabolic. Further, the muscle, when you work out, releases autocrine factors that are factors like MGF, which is IGF-1 but autocrine. Those autocrine factors, for lack of a better term, that are released by the muscle that may cause hypertrophy, they can get washed out during normal blood flow. But since you're having a restriction on blood flow, delivery back to the heart, what you have is a greater chance for those metabolic byproducts, those autocrine factors to interact with receptors on the muscle cell surface and cause hypertrophic signaling. Finally, it looks like it causes a greater accumulation of metabolic byproducts, lactate, other things. And these metabolic byproducts seem to have some sort of anabolic hypertrophy effect. We're not exactly sure how it works, but metabolic byproduct accumulation does seem to be one of the avenues through which muscle hypertrophy occurs. So basically, we think it's one of these three things, or a combination of all of them. Now, one other mechanism is by restricting blood flow, it seems to pre-fatigue these small type 1 fibers, thus preferentially targeting the large, fast-twitch type 2 fibers that have the greatest potential for growth. Now, people said, well, you said it's as good as heavy lifting. Is it any better? No, it's not better. It seems to have the same hypertrophy benefits as lifting heavy, but it doesn't give you as many strength gains because it's not as specific, obviously. Now, people I've seen, who was it? I think it was one of these guys online who claims to be scientific. Jez Carter, I think was his name. And he posted something very curt on my Facebook page regarding blood flow restriction training. And it was something to the effect of a study that showed that blood flow restriction was, if you basically said, why would you do blood flow restriction, just go lift heavy? If you like lifting heavy, absolutely. Not everyone likes that. Furthermore, not everyone can always do that. Okay? People get injuries. For a while there, the only thing I could do was blood flow restriction training, and it helped me maintain a lot of my muscle mass. All right? Further, if you're traveling, like in a hotel, if you're in a hotel gym and you have very light weights, well, now you can actually get a good workout in. Okay? Or for me, like when I was doing powerlifting with really high volume on the big three, I didn't feel like doing heavy barbell curls. I didn't feel like doing a lot of heavy accessory work. So I would use blood flow restriction to maintain my hypertrophy and things like my arms, my calves, my thighs, and just use light weights. So there's definite applications. If you have difficulty seeing the benefit of something that could cause you the same level of hypertrophy as using a very heavy load by using a light load, I'm not sure you are, actually you're definitely not qualified to talk about science. Now there is some data from Dr. Stu Phillips, and this is another individual on the YouTubes who I will not mention. And this individual basically said that, well, if you just take the same light load and take it to failure, you have the same hypertrophy benefits, and that shows that they just didn't have a good control group for these studies. They had a control group. Many of these studies, the control group was lifting the same load for the same reps and sets with BFR or not BFR, or lifting heavy weights versus BFR, depending on the question they were answering. See, when you ask a different question, sometimes that means you change the groups in your experiment that you use. I realize that this is a very difficult concept for some people, but changing the question changes your control groups. Now, research from Dr. Stu Phillips, who I consider one of the preeminent, if not the preeminent, authority on protein metabolism and muscle growth in the world, demonstrated that if you took the same load that you would use for BFR, 20% 1 rep maximum, and you took it to failure, that you got the same benefits as using BFR. I don't dispute that. I don't dispute that at all. However, that does not invalidate the effectiveness of BFR, nor does it mean it's useless. Let me tell you why. On people who are untrained, taking 20% of a 1 rep max to failure is fine. If you take a trained person and you have them take 20% of their 1 rep maximum to failure, good luck. You're going to be there a while. Okay? 20% of my best ever squat, 668, is around 135 pounds. Do you know how many reps I could do with 135 pounds on my back before I hit failure? My lungs would hit failure before my muscles did. Even if I did leg extension, it would take me such a long time to actually reach muscular failure that I would just rather use blood flow restriction because that accelerates the process. The byproducts accumulate faster, the pump happens faster, and you reach failure faster. Okay? It's just a way to make it happen a little bit quicker. Further, it's not just the same thing necessarily. The reason being that even when you look at research where they have them walk with BFR cuffs, you see hypertrophy. You can't walk to failure. I mean, I guess you could, but you can't walk. If you just walk without BFR, you don't see hypertrophy. So there is something inherently unique to blood flow restriction that causes some of these muscular adaptations, okay? So just saying we'll take the same light load to failure, while it may produce the same outcome, doesn't mean it's the same thing, okay? And it doesn't mean that BFR doesn't still have usefulness, okay? Because once again, you can reach that muscular failure quicker. You're not going to be there for 10 minutes trying to make yourself go to failure with a ridiculously light load. And you cause those metabolic byproducts to accumulate faster. So, now, let's talk about safety, all right? A lot of people, they hear this, and my friend Jeremy Lineky, who does a lot of the research on this stuff, he gave a presentation at our VIP camp a few years ago, and it was hilarious. He's one of the funniest people I know. And basically his entire presentation was him putting up quotes from people on the internet about BFR and then absolutely fucking annihilating them, and it was hysterical. And the title of the talk was, "Blood flow is good, you're an idiot." And he said, you know, don't you think that maybe one of the first things we thought about when examining blood flow restriction was that blood flow is good? That maybe, just maybe, that thought had crossed our mind. So there's been tens of thousands of people through these clinical trials. People don't realize blood flow restriction has been around since the late 70s. First it was called KAATSU, then it was called blood occlusion training, and now it's called blood flow restriction training. It's also been called tourniquet training. It's been around for well over 30 years, okay? And in that time, there has only been one instance where anything was possibly linked to blood flow restriction. And that was a case of a hockey player who had been doing blood flow restriction who came into the ER with pain and was diagnosed with rhabdomyolysis. Rhabdomyolysis is a situation where you have such large-scale muscle damage that it breaks down muscle so quickly that the products of that muscle breakdown have to be excreted through the kidneys, and it can shut your kidneys down. There's a few cases every year where people die. Usually it's people who are untrained who go in and do a really, really hard workout the first time they've ever done it, or people who were trained previously, took a long layoff, and then came in and went too hard. There's some serious problems with this case study, the first of which this person was trained, and thus highly unlikely that they went through rhabdomyolysis. I'm not saying it's impossible, but it's much more unlikely. Rhabdo is one of the most overdiagnosed things with regards to muscular problems in the United States. Further, when they released him, the doctor told him he was fine to continue whatever activity he was doing beforehand. If they really believed blood flow restriction caused rhabdomyolysis, why would they tell him he was fine to continue doing it? And finally, blood flow restriction has actually been shown to cause less muscle damage than traditional weight training with heavy weights. And so, if anything, based on the current body of literature we have on blood flow restriction training, based on the numbers of subjects through it, if anything, blood flow restriction is just as safe, if not safer, than regular weight training. Now, it has to be done correctly, and I recommend checking out my blood flow restriction tutorial on bodybuilding.com to learn more about this. But people confuse this because they say, well, you're restricting blood flow. You're doing it for a very short period of time. You're doing it for a couple minutes, and you're not restricting delivery to the muscle, because people say, oh, well, your muscle could become necrotic. First of all, that would take a very long time with a very tight wrap, okay? And you would be in such pain, such intense pain. There's maybe a couple Navy SEALs in the world who kept the wraps on, but you would have taken the wraps off. So that's not going to happen. The idea that you could cause a thrombosis, this has been proposed. There's no evidence that it is. Again, one thing that a lot of people, even scientists, do not get, they do not understand it, and it drives me crazy, is the difference between a short-term response and a long-term response. Exercise in the short term does what we would consider bad things. It raises your heart rate. It increases your reactive oxygen species. It increases your blood pressure. It increases inflammation. People would say, oh, well, those are bad if you look at that. But it's doing it in a short-term manner. It is like a vaccine. It is giving you a controlled dose of a stressor so that your body gets better at handling that stressor in the long term. So when are those things actually bad? When they're long term, when you have long-term elevated heart rate, long-term elevated blood pressure, long-term elevated levels of inflammation and reactive oxygen species. Short-term, having those elevated so your body can get used to handling them is a good thing. It's a good thing. So, and there's actually evidence that short-term blood flow restriction actually improves long-term blood flow. Okay? So again, do it correctly, but if you do it correctly, there is no evidence that it's more dangerous than normal weight training. Obviously, anytime you do any kind of activity, there is inherent risk. I'm not going to say there's zero risk. You have a risk stepping off your bed every day. You have a risk crossing the street. You have a risk sitting at your desk. There's risks with everything. But it does not seem as if blood flow restriction training has a higher risk than normal weight training. One of the other things is people just don't know how to read research, and it drives me crazy. And so the comment about the control groups really bothers me. I know I'm going back to it, but this person quite obviously had not read the research papers. Had not read them, but commenting on them. This is the problem when somebody believes that Google is a reasonable response, or they just regurgitate things that other people say. So please, actually read the research. If you're going to comment on it, at least friggin' read it. You probably won't understand it. Some of these YouTube and Instagram celebrities, you probably won't understand it, but at least give it the good old college try, okay? So recommendations on blood flow restriction training. It seems that you can do it as frequently as you would do normal weight training. I don't think it's a replacement for heavy training. I think it's a nice supplement to heavy training. I recommend it only for isolation exercises. I think that at a certain point, it gets so painful because of the pump that doing it as for compounds would be possibly dangerous, just because you'd be so focused on the pain rather than doing proper form. So that you always wrap proximal to the limb, so you're always wrapping here or here. You're not wrapping here, you're not wrapping here. Even for calves or forearms, you're not. You're always wrapping proximal to the limb. People ask, are there benefits to chest and back? Ironically, it does look like there are, even when wrapping here. If you're doing a compound exercises, like for example, a press, it seems to pre-fatigue the triceps, so more of your chest have to take over. It's not something I would use as my normal chest training, but if I was injured, I would consider it. There's a lot of protocols on how to run BFR. For the actual sets and reps and clusters that I recommend, I would check out my blood flow restriction trainer on bodybuilding.com. I can link that for you guys here. And again, remember, it's not a replacement for heavy training, but it's a nice supplement. And hopefully this video has helped clear up a lot of misconceptions about blood flow restriction training. And if you're looking for great papers on it, again, Dr. Jeremy Lineker is the world's foremost expert on blood flow restriction training. and I highly recommend checking out any of the reviews he's written. Alright guys, thanks for watching the video, and I'll catch you next time.